Good morning, everyone. I'm Dr. Alek Nikolic, and today we'll be looking at how to create a more subtle and natural enhancement of the lip using the HART technique. I'd like to introduce you to our model, our patient for today. This is Lene, and she's just noticed over the years that she's lost a little bit of volume of her lips, both the top and the bottom. And so we're going to be looking firstly at how we approach and analyze the lip and what the correct treatment technique should be used. So if we take a closer look, when we approach the lip, we need to consider, and it's easier to remember the approach and how to analyze by considering the 5 S's. The first is shape, then we have size. We also have the assessment at smile, but also obviously at pursing, and also the surrounding areas and symmetry. So even although I've mentioned symmetry last, I do like for us to consider symmetry because it needs to be used in every single one of the areas that we look at. If we look at the shape, that not only includes what the lip looks like, but also the shape of the lip from top to bottom, the way that the vermilion border is defined or not defined. If we look at the size, we want to see the ratio of the top to the bottom lip. If we look at this lip at rest, we can see that the top lip is slightly fuller than the bottom lip. And ideally, one would like to increase the volume of the lower lip so that we get a more 1 to 1.6 ratio. But please bear in mind that some of our Asian patients and even our African patients, a 1-to-1 ratio, and with some of our millennial patients, a 1-to-1 ratio may be acceptable. Let's assess Lene's lips with active smiling. So give me a big smile. So show us your teeth, so like a nice big smile. We can see that there's a slight difference on the top lip with active smiling and relax, which is also visible at rest. Though typically most lips have a slightly more curved area and a side that's more straighter. Why this is important to note is the curved side most probably will be easier to avert than the straighter side. So the straighter side most probably will require a little bit more filler to balance the two parts out. Just smile again, big smile. We can also see that the tubercle in the lower right is slightly fuller than the tubercle on the left. And again, we are assessing symmetry in all of these areas, and we would like to better improve the two sides when we enhance them. We're looking at the surrounding areas. We can see that there's a slight downturn at the millimental folds, and give me an active purse or kiss. We can see also that there's a slight indentation and a loss of support, but not too severe, and we can address this with today's filler as well. It's also important to note the length of the width from side to side, as well as where the majority of the volume enhancement should be in the lip. A good way to assess is to look at the limbus on either side, and one can see that this is correct in the sense of length, so we don't have to really change that in any way. And as a good guideline, the central part of the lip, which is delineated by the intercanthal intercanthal distance, and that gives us an indication of where the lip should be enhanced more than the outer lateral part of the actual lip. Okay, so we're going to start with the treatment of Lene's lips. What I'm going to be using today is the Juvederm Ultra 3. And these pen marks that I've done is just to really guide me. This is to keep the center of the lip. And these lines represent where we're going to be focusing our enhancement mostly. With closer inspection, we can see that the vermilion border or the edge or defining part of the lip has lost, particularly in the upper area, but we can see some of the vermilion border and definition in the lower lip. So we definitely want to not only correct those asymmetries we pointed out and naturally and subtly enhance the lip, but we also want to create a little bit more definition to the upper lip. What is vitally important is to always use alcohol or a similar antiseptic before actually starting the injection technique. It is important to support the lip structure And one of the approaches that one always needs to remember when using is to, with these threads, is to be extremely superficial. And the bevel must be facing up. That's now the bevel is facing towards you, the viewer, on the screen. And you can see that I'm going to enter just below the vermilion border, but not actually in it. So really superficial entry point. I'm going to start, Lene. You almost kind of want to see the bevel and the edge of the needle. You can see it just below the mucosa there. And then we slowly, as we withdraw back, it's a retrograde placement of the actual filler. It's really quite a small amount that we're doing. And immediately what's the important thing to do is to create a little bit of molding or massaging up towards the actual vermilion border. Remember, this is the curvier side, so it's going to require less filler than the other side. So I'm going to just fill some of these slight indents and deficiencies in the lip. Again, very superficial. I'll support the lip, and we're going right under the mucosa in a gentle thread as we withdraw or as we come out. And again, just mold that gently up towards the vermilion border. Turn a little more. I'm just going to fill the slight deficiency here, again supporting the lip, very gentle, very superficial, and a slight thin thread right there with a little bit of molding to ensure uniformity of the filler. Okay, then we're going to assess the lip with smiling again. So give me a big smile. Big, show me teeth. That's it. We can see that this area is nicely enhanced. There's obviously a deficiency in this area. And purse or kiss again for me. Again, we can see that that's nicely enhanced versus the other side with a slight deficiency there. Relax. So you see, open the mouth. You can see the importance of assessing the lip with active movements, especially smiling and pursing. And so where that slight loss of loss of volume is, we're going to put a little thin thread just under the mucosa and support that area with a bit of filler. We will obviously have to address the central tubercle, but we'll do that once both sides have been completed. Okay, we can see a little bit of deficiency along this area over here, so we do need to correct that. Again, I'm always using alcohol, and I'll also hold and support the lip slightly differently on the left versus the right, so we can clearly see that deficiency. So again, it's a very, very superficial entry into that submucosal area, and you can see the edge or the contour of the needle, and I slowly deposit a small amount of filler just below the mucosa, and immediately we place that pressure upwards. We can see that that indent and depression has improved, but there's still a slight line that needs just below that vermilion border entry point. So again, I'm going to correct that. Very gentle entry just below that submucosal layer. And then again, just deposit a small thread of filler. And again, we're going to place a little bit of pressure upwards towards the vermilion border, towards my thumb, just to ensure uniformity and even spread of that filler. And we can see immediately how much fuller and enhanced that is. I'm just going to ask Lene for a quick smile. Give us a big smile, show us teeth. We can see that that is a bit more indented on one side versus the other side. You can relax, so we will have to correct that. And show me an active purse. It's starting to even out. That still looks a little bit more everted, so we'll have to do a bit more work on this left side. Relax. Again, I'm supporting the mucosa. needle going in. Again, just below the mucosal layer, a fine thread as we come out. So it's a retrograde placement. We just want to correct that small indent and a little bit more eversion with active smiling. Needle going in. And immediate molding. If we take a close look, we can see that there's a slight deficiency and an indent right on this right side versus the left side. So we're going to enhance this central tubercle by placing threads and a tiny bolus at the very tip of the vermilion border on either side. We can relax. Open the mouth. This placement of the filler is right on that wet-dry border. Again, we're going to go extremely superficial. We go towards the very edge, small aliquot and a bit of a thread as we come out with a retrograde deposition. And we put a little bit of gentle pressure. Let's have a look. Purse for me, please. You can see that it's improving. We might need to do something a little bit more medial. Relax. We're always using the alcohol. Again, this is right on the actual dry wet border, above the muscle. We never want to inject below the muscle. And a small thread is placed there as well. And purse for me, please. And relax. Give us a big smile. Okay, we can see that that's a little bit fuller. Relax. Open the mouth slightly and relax. Thank you. We're going to approach and treat the lower lip. We can also see some loss of volume in that part just above the vermilion border, all along that lower lip, with the right a little bit more indented than the left. So we also want to correct that. And these threads are at slight angulations from the border, and we basically enter into the mucosal layer, staying or keeping above the muscle in the submucosal plane and towards the actual wet dry border. And then we deposit with a retrograde placement a fine amount of filler. Immediately we do the same molding action. Turn a little more for me, please, Lene. And I want to just correct that with a very small amount. Again, just entering through the mucosa very superficially, just below that mucosal layer, and a small thread. And again, we mold. Okay, so I've treated the left side of the lower lip, and now we're going to create the two lateral tubercles for the lower lip. Bearing in mind that the right tubercle is a little bit fuller and longer than the actual left side, so the left side will need a little bit more filler to balance that out. And it's just on either side of the midline. We're going to start on the left. We start just above the vermilion border and enter again very superficially, and I'm heading towards the dry wet line above the muscle. And you can see I'm depositing an aliquot, but I'm moving the actual needle. The inferior labial artery is usually behind the actual muscle, but in about 3% of cases it can be found a little bit more superficial. And so with the movement, one reduces the chance of getting that involved. And so we immediately mold that to give it a little bit of shape, and we can now assess to see how much light reflex that little placement of filler has achieved. And we can see there's a slight loss, which I will correct a loss of light reflex in that corner. And just so we balance the two out, I'm going to just extend this a little bit more. And again towards the dry wet border. And we're just depositing just below the mucosa. And again, we're just going to put a little bit of pressure. Okay, so we've treated the right lower tubercle, and we've placed a small amount of filler in either of the oral commissures, and with whatever filler was left over, I tried to support this supramental area. The total amount of filler used for the lips was 0.6 mils, and then the rest was obviously used in these areas. One can see obviously immediately after swelling that there is a little bit of swelling. Also, unfortunately, there's a small amount of bruising, but this is natural and one can expect this. It's a procedure expected type of side effect. Open the mouth slightly, we can see that the ratio of top to bottom is a little bit more in proportion, that the tubercles have been created and are a little bit more symmetrical. Give us a big smile. Big smile, show teeth. We can see that we haven't changed the teeth show too much, which is also very important not to do with the lip, and that a little bit more symmetrical, and also give us a big kiss, like a nice pursing action. And we can see that the two sides are also better equalized and that the tubercles are nicely enhanced. I hope that you found today's approach for a more subtle and natural enhancement to the lip helpful and educational. Until next time, bye-bye.